My name is Valentina González from Parallel A. Today I'm going to talk about Letermovir for Cytomegalovirus prophylaxis in hematopoietic-cell transplantation. The definition. Cytomegalovirus is an infection remains a common complication after allogeneic hematopoietic cell transplantation. If you contract it, you will have it for the rest of your life, but this doesn't cause problems for healthy people, but in immunosuppressed people. Letermovir is an antiviral drug that inhibits CMV terminase complex.
In this video, we're going to talk about cytomegalovirus, which we call CMV. And if we wanted to be really precise, we should say human cytomegalovirus because there are other non-human cytomegaloviruses. But we're just going to say CMV. So CMV is HHV5, and it's a beta herpes virus. And it receives a lot less press than the other herpes viruses, and that's probably because the vast majority of cases are asymptomatic. However, it can do a number of things. It can cause a mono-like syndrome. It can cause serious infections in immunocompromised people, especially AIDS patients and transplant recipients. And it's also the most important congenitally acquired infection in the US. And we'll talk about all these things later. But although it receives less press, CMV is totally ubiquitous. Up to 90% of 80-year-olds have CMV antibodies. You can acquire it any time, especially early childhood and adolescence. So why is it so common? Well, that's because it's transmissible in so many different ways. It can be transmitted directly from person to person or via fomites in the environment. Sexual transmission occurs. The one thing it can't do is spread through the air like VZV because CMV does not get airborne. But it's shed from saliva, urine, cervicovaginal secretions, breast milk, even semen. It can be acquired prenatally, perinatally, postnatally. Breastfeeding is a mode of transmission. And then it can also be transmitted in blood transfusions and even more importantly, in organ donation. So really almost every way that you can imagine. And when kids were studied in a daycare center, a third were secreting CMV in their urine, saliva, or both. So all in all, as you can imagine, because CMV is shed so commonly and from so many different places, it's really hard to prevent transmission. So let's quickly go over the pathogenesis of CMV. So it's secreted in almost every imaginable way. And then how does it infect a new host? Well, usually by getting in through the upper GI tract, the genitourinary tract, or the respiratory tract. So that's actually more common than the blood transfusion, transplant, breastfeeding kind of stuff that we talked about. And from there, it infects lymphocytes that traffic around the body, and it hitches a ride on those cells and spreads to multiple tissues. And whether it causes a symptomatic or asymptomatic infection, cell-mediated immunity is critical in controlling the virus. And then like a good herpes virus, CMV establishes latency. And the cells that it establishes latency in are myeloid progenitors in the bone marrow. And these can differentiate into circulating monocytes that will also be carrying the virus. So this is a virus that's great at immune evasion. It literally hides out within the immune system. And like other herpes viruses, since it's latent, it can reactivate and cause either symptomatic disease or asymptomatic infection, in which case it can still be spread to other people.
Now, the application in medicine. Letermovir is the new highly potent anti-CMV agent with a novel mechanism of action targeting the viral terminase subunit pool 5656, a component of the terminase complex involving the viral DNA. Cleavage and packaging that has no equivalent target enzyme in the human body. As such, Letermovir also provides a potential new treatment option for patients infected with CMV strains that are resistant to approved antiviral drugs.
We are presenting a randomized placebo-controlled trial of a new antiviral drug against cytomegalovirus called Letermovir. These are the results of the study that was multinational, going on in the US, North America, and in Europe, with EBMT as a very strong supporting actor in the European part of the study. The CMV is a virus causing significant morbidity and also additional deaths in stem cell transplant. And this study was aimed to prevent what's called significant CMV infection. It was approximately 500 patients randomized. And the results of the study show not only that significant CMV infection was significantly reduced, meaning that the study met its primary endpoint, but it also showed that at 48 weeks after transplant, namely almost a year, the all-cause mortality and the non-transplant, non-relapse mortality actually was decreased in the patients that got Letermovir. I also should say that it was well tolerated. So there were some side effects, of course, as with all drugs, but no very severe side effects. Well, the next steps, of course, is that the drug hopefully will be approved. It's a new drug, so it's not licensed for use anywhere in the world at this moment. Basically, were very limited side effects, and the side effects were mostly from taking an oral drug. So it was some gastrointestinal side effects, as with almost all drugs, but very low difference to the placebo, and no renal toxicity, which is important in stem cell transplants, and even more important, no bone marrow toxicity. The data is just coming out now, and I would expect, if the authorities think this is a good drug and license it for use, I think it will be included in the algorithm, meaning that we would use a prophylactic drug against CMV in at least significant proportion of allogeneic stem cell transplant patients.
Now the pros and cons. The pros. Letermovir works as an inhibitor for the CMV terminase DNA complex that further inhibits the processing of viral DNA. The dose-response data show higher efficacy of Letermovir with dose of 214 per day. Cons. Virus of lack of activities versus others may cause vomiting, edema, flutter, and arterial fibrillation. Mortality from all cause after transplantation among Letermovir recipients is usually a little high.
So Letermovir is an antiviral drug that is active against human CMV, and it was approved last year for the prevention of Cytomegalovirus infection in bone marrow transplant or hematopoietic-cell transplant patients who are CMV seropositive, right? So this was based on a phase 3 trial we had the opportunity to lead, in which patients were randomized to Letermovir or placebo and received the drug anytime after transplant through week 14 or day 100, and then people were followed for 48 weeks. And the study showed that patients who received the active drug had much lower risk of developing what in the trial was called clinically significant CMV infection, meaning having CMV viremia detected in their blood, and that require preemptive therapy. And that treatment was very well tolerated, with minimal excess toxicity compared with placebo. And the other thing that was interesting is that there was a lower mortality or higher survival among patients who received the drug compared to those who received placebo.
Issue play in Ecuador. The medicine is available in the form of oral administration tablets in IV solution vials for intravenous infusion. Both presentation are available in doses of 240 and 480. The recommended dose is 480 per day. In conclusion, prophylaxis with Letermovir produce a significantly lower risk of clinically significant CMV infection. Adverse events are low grade, have a lack of cross resistance with available drugs, and good tolerability. Thank you.